Guys, welcome back to Medical Coding with Blue. Today's episode is all about how many hours per week should you study if you're wanting to learn medical billing and coding, or you want to refresh your knowledge, or you're coming over from the medical side and you want to know how many hours should you be studying, and does that experience make a difference? If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, so when it comes to learning medical billing and coding, there's so much. And while sometimes people are coming in, they have prior experience in the medical field, or maybe they have prior experience in coding as it is, there's still a lot of things to learn because the guidelines get updated every year, the code sets get updated every year. We have diagnosis codes and we have procedure codes. There's outpatient procedures and there's inpatient procedures. So there's 3 different kinds, and then plus you have your HCPCS manual that has all of your, it's catch-all basically. And so it's got some more procedure codes in there. It's also got your durable medical equipment, and it's got other things like mileage and things about air ambulance. So it catches everything. But with that said, because there is so much for us to learn, I've always said that it's 20 hours per week when you're studying medical billing and coding to try to study for a certification exam. I used to say that you could probably get away with studying like half of the time once you've gotten your certification and you're out in the real world, and I still recommend that you all study. Well, I used to recommend doing half the time, but you know what? Now that I think about it more, I really think that even people who are struggling maybe with a new specialty that they've been assigned to, they should also be studying 20 hours per week. And if that sounds like a lot, it's really not, because we all have the things that we do on social media, right? Everybody's on social media. You're there with your phone, you're playing with your phone. If you're not on social media, you may be playing with like games and things like that. Candy Crush, if they still do that, I don't know. But people are still with their games, or they're doing other things. So there's little pockets of time that you can still make in order to study a subject that is going to help you to become faster later. On my channel, I stress doing things the old-fashioned way, which is to actually study and actually read the books. And when I say study, I mean to read the book. I mean to actually work out the problems in your workbooks. Like, I know a lot of workbooks come with multiple choice. I recommend covering up the multiple choice and working out the questions, so that way you can kind of isolate where your issue is, what you're forgetting to pick up and things like that. So these are the things that you can develop to help you to be a strong medical coder. There's a lot of weak coders out there, and they're weak not because they don't have the drive to want to do this, but because they don't know how to properly study. And the reason that I say this is because there's a lot of schools that pump out these students and they promise them, oh, you can get in and out in just 2 months or 4 months or 6 months, and we can get you on the road to making this high amount of salary. Meanwhile, these same people are being taught how to pass certification exams, because they're all multiple choice, right? Pass these certification exams, and they're just taught how to get through the exam, because we need to have those numbers according to the school. We need to have these passing numbers so we can boast about our quality program. Your quality program is not so quality, okay? That's first of all. Second of all, if you are not teaching critical thinking as a health information coder instructor or instructor, shame on you. Because the simple fact is, you're pumping out these people who are not prepared for the real world. They get out in the real world very disillusioned, and then you have people making posts and complaining about how they think that this is such a scam and that they got taken for all this money, and that, you know, they don't have anything to show for it. They don't even have a job. And a lot of times what's happening is a poor resume, okay? And then even if they do happen to get a good resume, what happens? They get an assessment test and they can't pass the employer's assessment test. Why do they test us, Blue, if we have a certification? For the simple fact that there are schools out there that teach people specifically how to pass a certification exam. They don't teach them critical thinking, which is why I have made it part of the mission of this channel, because this channel has a couple missions, right? But one of them is to help you all to see that you actually have to read. You actually have to go through the pain of going through and going with these scenarios and trying to code them out yourself. Are you going to get all of them right from the get-go? Absolutely not. It's going to take some time to grow. You need the time to nurture your capability. And the only way you're going to do that is by putting 20 hours per week in. Now, 20 hours per week, you may think, no, Blue, I can only get 10 hours per week. I've got kids, I've got all these things. Well, I've had this channel since 2018, and several single parents or parents that are like, it's both of them, and they have children who have extra needs and they need help, and or they're taking care of their parents, or whatever the case may be. They have implemented the 20 hours per week, and that's how they got their job, and that's how they've been successful and been able to pass their exams on the first try, because they listened to me. Because when all else failed, and they said, okay, well, the school didn't help me, and I still don't understand. But once they saw putting in that 20 hours per week, that was what was really helping them to finally get it. Because it doesn't seem so scary after a while. Once you've put in that time, and you can learn, and we'll talk about how to put in those 20 hours. But once they put in that time, then they're able to see like, oh, this makes more sense. This is, oh, I get it now. Because you're not going to get it at first. You are not going to get it at first. But once you do, the more that you read, the faster you will go. And the more that you will pick it up. And for my people that English is their second language, somebody had wrote me today and said, well, Blue, English is my second language and I read slow. Do you think I should pursue this? Don't you think if you are practicing your reading that you will become faster? Runners, long distance runners, Olympians, these Olympic runners, do you think that the first day that they decided to become an Olympic runner, that they were running those fast times? No, they conditioned their bodies in order to get to that point. They got up every day. They went and worked out. They gave their body the proper nutrition that it needed. They hydrated themselves so that their bodies could stay active. It is the same thing that you have to do as a coder, right? Or as a coding student, or somebody returning to coding, is to get into that 20 hours in order to do this. But if English is your second language and you say, well, I read slow, and you don't take the time to do these 20 hours, well, I would say the same thing to anybody else who English is their first language, is that you shouldn't be pursuing it if you can't make the time for it. If you can make the time for it, oh, trust me, you will be able to get past that, and hey, I can do this. If you want to do it, you'll be able to do it. If you don't want to do it and you want to make excuses and everything hurts your feelings and I'm so mean and all this and all garbage, okay, well, trust me, there's plenty of other salespeople who will be happy to sell you whatever sugar that you need. But here on this channel, let's get serious. Let's get serious about this. 20 hours per week. It is not hard. I used to make these and sell these, but I don't sell them anymore because it's too confusing for some people. So this is a 20-hour study tracker. This is a study tracker. If you, this is 1 week's worth, right? So it's sort of like a money savings challenge, but you can make this yourself. I'm not selling this. I'm just telling you, this is how you can make this. You go and you get a calendar, you get something. And there's 30 minutes, there's 60 minutes, and I think there was like 45 minutes on here somewhere. But this is your study times. This is how you track for the whole week how much time you're putting in. This is 20 hours. There are some that are 30 minutes, and then there are some that are 60 minutes. So what you do is every single time when you wake up in the morning and you're brushing your teeth, you could be listening to an anatomy channel. And even if you have experience, my nurses, even if you have experience already with anatomy, oh, I don't need that. Trust me, if you've been an OBGYN nurse, guess whose anatomy you should be studying? Because guess what? Coders do not only code one thing. It is multiple conditions, whatever conditions the patient is coming in with. And it is not just one gender, right? Well, if OBGYN, okay, but like in the ER and all these family practice, you're coding for everybody. So you need to know the anatomy. There's no excuse, well, I've only done OBGYN. Okay, well, that's why you got to study your anatomy, okay? So while you're brushing your teeth and getting ready for the day, 30 minutes, you could be listening to an anatomy channel on YouTube, okay? Anyone. Or you could be listening to HIPAA, or you could be listening to something about medical terminology or something, or you could be listening to the guidelines. That's 30 minutes while you're doing all that. And you're still getting about 10% of what you're listening to, but the exposure is there. This is what you're using to cultivate your knowledge base and your critical thinking, because you're listening to it. It's an active part of your day. You get to work. You're sitting there, you're on your 30-minute lunch break. You could be watching a video on your phone. You could be doing flashcards on your phone. That's another 30 minutes, okay? That's another 30 minutes that you've done. And this is in one day. And then you're driving home. Everybody's got a Bluetooth. You could hook your phone up to the Bluetooth. You could be listening to another anatomy channel or something else related to coding. You could be listening to that on your drive home. That's another 30 minutes. That's an hour and a half already that you've done. Then you get home, you take care of all your home chores, whatever you got to do. And you get everything all settled down, and then you start working with your workbook. You set a timer on your phone for 60 minutes, 55 minutes if you want to, but 60 minutes. And then you take a break. You do not keep pushing through and try to, muscle through. No, you will forget everything that you're doing if you do that. You do those 60 minutes, you work with your workbook. You start looking through your book. And that's how you're putting in that time to learn, okay? And then take a break, do whatever you got to do, 10, 15 minutes, 30 minutes, another hour goes by, and then you come right back to it, and there's another hour that you're working out. That's 3.5 hours you did in one day. Then you do this consistently for 5 days, make this a habit, and that's 17.5 hours you've done. No, but you're not done yet. You are not done yet. You have 2.5 hours left, and you do not neglect those 2.5 hours on the weekend, on a Saturday or Sunday. Oh, that's all you need is 2.5 hours, and you do the same thing, 30 minutes or 1 hour at a time. You do that, you listen to something, you work with your workbooks for those 2.5 hours. Don't neglect those 2.5 hours, because that is 10 hours in 1 month if you skip out on that. Oh, I'm going to keep the weekends free. Don't you dare. Don't you dare. You either put that extra time throughout the week and make it 4 hours per day, but 3.5 seems reasonable to most people, okay? But don't you dare skip out on those 2.5 hours on a Saturday or Sunday, because like I said, you're going to miss out on 10 hours, and that 10 hours will make a difference. There's a huge difference between somebody who's been studying for 80 hours in 1 month versus somebody who's been studying for 70 or less. So with that said, you check off every single time, and then by the end of the week, you will have filled this out. Now you can laminate this. I didn't laminate it, but you could laminate this, and you can use a dry erase marker. You could be coloring these things in so you can track your progress. You can see that you've been studying, okay? So whether you are going through a school right now or you're going through my independent study, the syllabus is for sale. It is in the description box. You could be doing something like this for yourself, making your own, and then that way you can bubble it in as you go, and then that way you can keep track. And that's how we stay consistent with studying for 20 hours per week. If you think that you only need, half the time, it's going to take you longer, because reading the coding guidelines, which the challenge starts October 1, okay? I'm going to release this before October 1, but the challenge starts October 1. You're going to read the ICD-10-CM coding guidelines for either 2025 or 2026. If you are studying for an exam with a HEMA and you're taking that exam before the end of April 2026, you should be reading the 2025 guidelines, because that's what your test is going to be based on. If you are taking an exam with AAPC, you should be, and you're taking your exam after January 1, 2026, then you want to be reading the 2026 guidelines, okay? And so I have left the links in the description, and I'll go ahead and leave those 2 links again in the description box for the 2025 or the 2026 guidelines. So depending on where you are, if you are not taking your exam till August of 26, then you want to study with the 26 guidelines, okay, the 2026 guidelines. But all of that takes time. Either listening to those guidelines or reading the coding guidelines, that takes time as well. But that's part of your 20 hours per week. And trust me, you do the guidelines 4 times in the month of October, and that's taking a few days to read the guidelines, right? But you're going to be a faster reader. You're going to know these things because it'll already be in your mind, right? It'll be in your mind. You don't have to memorize. And that's where people get hung up too. Well, do I have to memorize? No, you have your book with you. There's no hiding those guidelines. You can see those. But it's going to help you to know exactly where to go if you need to be reminded about injuries, if you need to be reminded about sepsis or mother-baby or some other CKD. You know what I mean? Like if you need those reminders, you're going to know exactly where to go in the guidelines. And that's very important to you. Okay? So taking the time to study 20 hours per week, whether you have experience or no experience, or you've been put into a new clinic and you're like, oh crap, what do? I don't know how to code this. If you're put into a new specialty, you put in 20 hours per week, and just to get yourself going, just to get yourself started, well, that's fantastic, because guess what happens? When you do that, that's going to help you to get quicker, you're adapting to that new clinic. And that's going to stand out in your workplace. And that's a good thing to have, because a person who can do that and who is very versatile is going to be able to write their own ticket a lot sooner than somebody who needs their handheld every minute of, oh, I don't understand this. It's okay to not understand something. It's okay to ask questions. That's perfectly fine. But if you don't show the gumption to say, okay, I got these 20 hours, I'm going to study. Okay, I'm going to start working with this. If you can't do that, it's setting yourself up for heartache. A few years ago, I got pulled out of ortho. I got pulled out of ortho. Oh, I was hot. I was like, oh no, you can't take this from me. But I got pulled out because they needed help in the pulmonary clinic. It's in Blue. We really need somebody who can get in there and dig, because we don't know what's going on in pulmonary, and we need somebody who can get in there and figure this out. It was an education issue with the providers. And so that was what it took. But had I ever done pulmonary before, I had done I had coded for pulmonary patients when they were up on the floor, when I was coding for inpatient professional service, but I had never coded for the clinic. So when they do procedures in the clinic, it's a little bit different from what they do up on the floor when the patient is admitted. So with that said, there was like, okay, I'm straight into the frying pan. I got to figure this stuff out. You know, they're counting on me to figure this stuff out. And I'm not going to let them down, because, of course, my whole thing is I want to get back to ortho. Let me clean this up so I can go back to ortho. Just let me have my clinic back. You know, that's what I wanted. And sure enough, I got in there. I was like, okay, I have to go talk to these techs, these nurses that are doing these procedures. I got to go talk to them. I got to go talk to these doctors and find out what it is that they're doing. And I got to provide them some education, to get some one-on-one time with them. And so we can get all this straightened out. I've got to go to the American Lung Association and start reading about the conditions that affect the lungs and how all of that works and things like that. So that way I can understand what it is that I'm reading. And I'll be able to know, like, okay, is this common? Is this common? Is this not so common? And I'll be able to know these things. I started putting in the time. And with that, I was able to pick it up quick. I went over the CPT manual for all of the respiratory procedures, just so that I knew what they did or what they had the capability of doing. I went over that. I went over the medicine section as well, because there are some things that are not always only included in the respiratory section. There's a lot, the medicine section of the CPT manual is a catch-all too. So it covers a lot of different things, but I made sure that I went over both of those sections. I went and I looked at the guidelines for the respiratory chapter in ICD-10-CM, which is your diagnosis coding. So I went over all of those things, and I practiced and I practiced and I practiced. So that way, once I could get everything straightened and situated, I mean, they were fly birdie fly after that, and they've still been fly birdie fly. So once I completed the mission of getting them back on track, I got my clinic back, and I was like, okay, I can handle this, you know. But it's nice to be called in to help. It's nice to be called in to be like, okay, we know you dig. That's what I do, is I dig. Let's find the root of the problem. I'm not going to sit here and play games. We've got to get to the root of this problem, because it was just such chaos in that clinic. And if there's not somebody in there with a firm hand, it's always going to be chaos. And so that's where I came in to like, okay, let's get some stabilization here. But how did I do that without having first been coding for that clinic for years? Is doing my research and studying 20 hours per week. So you can study for 20 hours per week to get yourself started, maybe a couple months. If you've already been a coder and you say, okay, well, I've got 60 days, that's like a boot camp, right? 20 hours per week, 160 hours worth of study. That's going to really give you a boost. It's going to give you a boost of confidence. It's going to give you a boost in, okay, I can do this. And the more knowledgeable you speak, these doctors, oh, they recognize that really quick. They know who knows, and they know who doesn't know. And they know who's confident, and they know who's not confident. And when you have confidence, they know if you're full of it or not, because people can act confident, but if they don't speak the language, and trust me, these doctors, they're listening, and they know who just is talking the talk, but they also know who can walk the walk. And again, I tell you that there was nobody when I was coming up on YouTube that I could go to be like, oh, you know, well, how do you do this? How do you study? How do you study? All these videos, I have 1,500 videos on my channel, and I still get messages. How do I study? Not answering, because I have all of these videos. It's that easy just to look through them. Independent study, how to study, study tips, medical coding study tips. I've done it several times. And it is on you, strong coder, to be a strong coder, okay? But the only way you do that is to study, and you keep track of your time. And so that way you can do that, you can work through those things, and you can see your own progress, and that way you can stay on track. And that's what you do. And if 20 hours is too much for you, don't write to me telling me that. I don't want to hear it. And I will say that. And no, I'm not being rude. I'm being direct. Don't tell me that you don't have 20 hours. When these same people who say, I don't have 20 hours, I've got a house full of kids, blah, blah, blah. And they're still right there on the TikTok or on the Instagram or on the Facebook or whatever it is that y'all are on. Snapchat, I don't care. Y'all are on something, right? But still right there. But you don't have time to study? Please, don't waste my time. My time should be for other people who have legitimate questions about things with this field. I'm just saying. So with that said, I know. Well, you don't have to be so mean. I know. But hey, at the same time, with a lot of these things that I say that are very direct, at least it's going to get your attention, isn't it? I'm just saying. So with that said, 20 hours per week. That's what I recommend. Even if you have experience, even if you've been a nurse, even if you've been a radiology tech or pharma tech, whatever, you still need 20 hours per week, because if there's something that you know you have a weakness on, say it's evaluation and management. I have done a specific syllabus for learning evaluation and management. It's in the description box below. It's very reasonable. And I even tell you what book to get. Now, the only thing that you're getting from me is, of course, the document. But you have to order the book, and it's the Optum Evaluation and Management Coding Advisor. That syllabus will work with the 2025 or the 2026. I don't think the 2026 is out just yet, but it'll work with either book. And if you get like a year older book, if you happen to find a year older book someplace else other than Optum, maybe you got the 2024 book, it'll still work. You'll still get the general idea, but anything older than that, kind of gets a little shaky. So if you're going to do the study syllabus for evaluation and management, again, in the description box below, you want to stick with the 2024, 2025, 2026. Okay, so that way you can be most current. Okay, so with that said, I'm going to go ahead and wrap this one up. But yes, guys, this is serious business, and treat it like it is. Okay. And the 20 hours a week, like I said, it doesn't last forever. If you are already a coder, you're going into a new clinic, or you know you need to refresh, you can do the 20 hours per week for the 2 months. Make it a boot camp. And so that way you can kind of like really concentrate and you'll have it. I still recommend you continue to study if there's something new that's coming out, of course. But this is just to get you jump started. This is just to get you going. And trust me, you'll be a lot more confident putting in the time. You got to put in the time. And 20 hours per week is nothing. It is literally nothing. And it is possible to do. But you have to want to do it. Okay? I'm just saying. And for my students that are out there studying, and you haven't gotten your certification yet, or maybe you're studying on your own, or maybe you're going through the Independent Study Syllabus, or maybe you're going through a program, this is how you build your discipline, by getting those 20 hours in. And trust me, it takes 30 days to build a habit. Once you get past that 30 days, it's going to be very easy for you to continue that habit. Okay? But you need to be studying 20 hours per week throughout your time in school. Yes, there may be some weeks that, I couldn't make it because I've got all this other stuff going on. But you need to go right back to those 20 hours and do not backslide and, I could only do 5 hours. Then you don't really want it then. I'm just saying. With that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.